Pelosi said in a letter last night to House colleagues that the overwhelming guidance she is getting is that members of Congress want to do fewer things well when it comes to the reconciliation package, the price tag, and what gets included. Does the president support that approach, doing fewer things well?
Well, she also gave a full press conference this morning where she addressed this, so I would point you to that. And what she said in that press conference was, if there are fewer dollars to be spent, there are choices that need to be made. And the president agrees. And that's fundamentally true, of course. If it's smaller than $3.5 trillion, which we know it will be, then there are choices that need to be made. But the president's view is that a bill that doesn't pass means nothing changes, and the challenges we're facing are too urgent to do nothing. So that's why at this point what we have to do is work with a range of members who have a range of views about what should be included in a package, what is a priority to them, so that we can make some fundamental changes. We are focused on the impact, and that's what we're keeping our eye on.
Is the White House concerned that with the House and Senate on recess right now, that talks will stall without having lawmakers in Washington?
The good news is there are phones, and we are quite used to Zoom conference calls this day and age, and those have continued through the course of weekends, through the course of nights, even as members have been away, and we anticipate those will continue at full speed over the coming days.
Just one more if I can, going back to Texas. What is the president's message to businesses in Texas? You mentioned several of them who are based there.
Yeah.
When it comes to what the federal guidance is now, and now with this state executive order, what would the president say to those companies as they're determining what they should be doing right now for their vaccine mandates?
Well, we know that federal law overrides state law. I would note that earlier when we put out our guidance on the president's announcement about mandates several weeks ago, it made clear that, again, as I said earlier, requirements are promulgated pursuant to federal law and supersede any contrary state or local law or ordinance. Additionally, nothing in this guidance excuses noncompliance with any applicable state law or municipal ordinance. We put out guidance several weeks ago conveying that clearly. But fundamentally, beyond the legal aspect, which is unquestionable in our view, the question for any business leader is, what do you want to do to save more lives in your companies? How are you going to create a workforce where people feel safe to go into their workplaces? What is fundamentally in the interest of your businesses over the long term? And we've seen from economist after economist, and frankly, many business leaders who have already worked to implement mandates, that implementing these mandates creates certainty. It reduces the number of people who are out of work sick and worse. And that is good ultimately for businesses. It's good for the economy, but also saving lives is something fundamentally business leaders can do by continuing to work to implement these mandates. But I would note that a lot of these businesses are doing them on their own to date. We're still, the OSHA, in terms of the federal level, the OSHA requirements are the next step, which we expect to have soon. Go ahead.
Thanks, Jen. Clearly, Governor Abbott knows that federal rules supersede state rules, so why do you think he did this?
Politics.
Can you elaborate?
Well, I think it's pretty clear when you make a choice that's against all public health information and data out there, it's not based on what is in the interest of the people you are governing. It's perhaps in the interest of your own politics.
And then I know